Hi, my name is Dr. SaraLaureen Bartels, and I work as a postdoctoral researcher for Maastricht University. Today, I'll be talking about measuring momentary cognition in a memory clinic sample with mild cognitive impairment using the experience sampling method, an exploratory validation study. About 1 out of 5 people above the age of 75 live and are diagnosed with mild cognitive impairment. This is a clinical neurological condition where cognitive impairments appear, but everyday functioning is mainly preserved. In clinical context, when clinicians aim to understand the impact this condition has on the person's everyday life, they use several methods, which are all valid, but have some limitations. First of all, there are neuropsychological tests, structured tests to assess different cognitive domains. However, neuropsychological tests are administered maybe once or twice a year and are therefore unable to detect fluctuations in cognitive functioning. Furthermore, proxy reports are used from family members or close relatives, and these add an important puzzle piece to understand the everyday functioning. However, they are affected by memory bias. Furthermore, there are self-reports, which can equally be impacted by memory bias of the participants, and people with MCI also experience limited insight into their condition. Therefore, they provide an incomplete picture. So how can we get a better insight into how people with MCI experience their cognition in everyday life? And that is the question here. How do daily experiences of people with MCI correlate with or relate to with cognitive problems measured in clinical settings? And to study that, we use digital diaries, also known as experience sampling method. And we previously published a paper about the feasibility and usability of this method in people with MCI, if you want more information on it. We gave this diary to 22 people with MCI, and they filled in 8 assessment time points reflecting on their momentary memory, language, and concentration problems for 6 consecutive days. We also used questions on their momentary mood, fatigue, stress, sleep, and other contextual factors. So they rated basically a question: since the last beep, I experienced memory problems, language problems, or concentration problems on a scale from 1 to 7. 1, not at all, 7, very much. We also included a neuropsychological screening tool, the MMSE, a proxy tool, the DCE, and a retrospective self-report, as it's often done in clinical settings. We then correlated the average, peak, and range scores of the momentary tasks with the clinical tools using a Spearman rank correlation. For that, we included 19 participants because 3 had not completed enough ESM assessments. The results showed that the clinical tools did not correlate with the momentary cognition scores, and they also did not correlate with each other. However, the momentary cognition scores correlated with each other, as you can see here, on a medium to strong level. So what does that mean? Clinical assessment tools and ESM measure seem to measure different aspects of cognition. Interestingly, we can see here on these pictures that momentary cognition varies strongly between different and within different individuals. However, we do need to acknowledge the small sample size of this study and potential measurement issues, such as the ceiling effect in the MMSE. Prospectively, we want to expand our study to also include internal validity indications by correlating the momentary cognition scores with other momentary variables such as fatigue, mood, or stress. We also aim, or future studies should aim to include a larger and more heterogeneous sample, as our MCI sample was rather high, rather good in cognitive functioning. And potentially also expand to include more neuropsychological tests. Yeah, thank you so much for your attention. And if you have any questions, please contact me via my email or via Twitter.